It's an interesting, thanks, Danny, an interesting tool to add to the toolbox. So I'm hoping I can share some of the highlights with you, and then we can open it up for some conversation, and we can get into some of the more details about the particular presentation of this method of collecting data qualitatively through asynchronous online focus groups, or AOFG. Either way, it's a mouthful, so we'll come up with a better acronym soon. We love our acronyms. So this is really meant to be an introduction to the methodology as I've seen it over the past 12 months. So just to kind of recap or make sure we're all on the same page, first, acknowledging that focus groups, they're one method of collecting data in a qualitative fashion. We often see them in market research. That's actually where I was first familiar with them back at WorkSafe New Brunswick. We would do a lot of market style research with injured workers to better understand how to provide services. So if you've ever used a particular service, a cell phone or the internet plans that you might have, or a particular product, you see a lot of advertising groups using these to get a sense of a particular user group's needs or to evaluate a program. So focus groups are a great tool to facilitate a group discussion that really depends on the dynamics of the group itself, the people that you bring together to generate that data. Like a lot of research methods in terms of data collection, there's a lot of pros and a lot of cons, and we always have to be cognizant of these. So with the pros, I mean, it can be relatively inexpensive to bring together a group of individuals. Normally, you try to aim for 8 to 12, hoping that you get at least 6, and that 8 to 10 is sort of your sweet spot for the number of folks around the table to ensure that you have enough dynamics to generate the data that you will be then either recording via audio and or visual methods, as well as field notes, as you perhaps observe from a room with two-way mirror. And with all those pieces of information, then you can come together and get a sense through either content or thematic analysis, often being very common ways of analyzing the qualitative data to then say, okay, what's happening? What are the needs of this group? What are the challenges or opportunities that they may have in front of them? So it's relatively inexpensive to bring together, a larger group of people in one space at one time. You get pretty candid responses. They often are first thing an individual will say in response to somebody else. So they do tend to be more natural in building on other people's responses. The challenge, of course, is the facilitation is a real big part of the development of the quality of the data. If you have an experienced facilitator, they can, notice if somebody across the table is not answering, particular question, if they're not responding, or if somebody else is taking over the conversation, you can perhaps put a pause on that and see what other people are feeling. So you really do need somebody who is very skilled in that, and you can either hire research companies to do that particular their skill set for you, or a lot of practice yourselves to develop that. There's also a potentially large volume of data, but I think just generally speaking from a qualitative lens, we're not shy about that. There's always going to be a large volumes of data, but it can be a challenge depending on particular timelines that you might have. And then as well, there is selection bias. You're going to have certain people that are going to show up to these kinds of groups. If you're asking about opinions about cell phone plans, I'm thinking of that one because I actually did a focus group years ago as one of the 3 cell phone companies, and you go and sit in a room and you either have really good things to say or not so nice things to say. So it depends on the topic, the focus at hand. You have to be mindful of who's coming to the table and who isn't at the table. And the last part is really what we're going to talk about more, is it requires particular place and time. So yes, it's relatively inexpensive to bring people together at one place at one time, but does that work for everybody? And when it doesn't, how can we address that? So first of all, we'll talk about place. And I think this is something that's very top of mind when it comes to the last 2 years. It won't be great when we can stop mentioning that as our point of reference, but here we are. And, it is very much, it is top of mind because, we're trying to pivot and change our research to talk about ways of collecting data that allow for us to reach out to people that are in a way that's safe and can be mindful of individuals' needs during a pandemic. So is there a virtual place? And of course, we all know, yes, the answer, assuredly so, is online platforms. Sometimes it goes well, sometimes not so much, but we're all learning. And it's really ideal to use these tools, this technology, because people can connect from their own location rather than a central space. So again, pros and cons, that does address perhaps individuals' transportation needs. Perhaps it addresses ability to, get away for a particular period of time. Maybe they can spare a half hour, an hour versus, 3 hours to get there and back and find childcare, et cetera. But it also means that you have to have a space in your home that is safe and appropriate. So you are, again, they're introducing a particular selection bias that way, that you're going to have only certain people that can perhaps have this equipment and whatever. But all that said, it is one particular tool to adjust in light of the needs that we have for doing these things safely and to reach perhaps more remote populations and invite more people. So it's really going to depend on the question and the folks that you're going to be working with. But yes, we can do a virtual time, we can do a virtual place. So the next question then, what if the time isn't ideal? And that's an interesting thought, because we're very much attuned to, in our project planning, to saying, okay, we're going to set up X and Y, we're set up this date, this time, and we're going to, maybe we'll do it on Zoom now. But we don't necessarily think of, well, what if 6 p.m. on a Wednesday doesn't work for everybody? What if 12 o'clock on a Monday doesn't work for everybody? Do I just start having, ad infinitum, these focus groups over and over again virtually just to make sure I can get as many people as I need? Or is there a different way to approach it? So solving the quote unquote problem of the synchronous focus group. Because up until this point, that's really what we're talking about, is a synchronous approach, everybody in the same space, virtual or otherwise, but also at the same time. And this is where we get to the asynchronous focus group. So before we get into the challenges, the different features and ways to approach it, so the asynchronous focus group is basically a way of setting up a virtual space that over a set period of time, the people in your focus group come together around the virtual table in some sort of discussion board or messaging format. And often what you see is that over a period of 24 hours, they can respond at their leisure. Ideally, when you think of this actually works quite well for individuals who perhaps, maybe it's not even just transportation that might be a challenge, but if you're a caregiver, for example, I know a lot of researchers on this particular call do work with individuals with lived experience, but also who provide care to those and have with particular conditions or complex health needs. It's a lot easier to answer a question when things fit your schedule, because your schedule doesn't necessarily follow the schedule of everybody else that perhaps you would normally collect data from. Or another way, a way of looking at it is it provides people with the time as well to reflect on just the complexity and vastness of their experience to then answer the question appropriately. Now you can argue that, will they moderate their own response? Will they not answer in a, honestly or truthfully? I mean, there's always, you could debate that a bit. I think there's also a bit of, you have to assume that people are, if they're coming to your table to answer questions, my experience has been that they want to do so in a manner, because they want to improve healthcare. So sometimes giving them more time makes things better for everybody involved, and not only gets you better data, but also makes things more comfortable for them. So that's the idea. You set up a discussion board. You give them, 24 hours per question, and usually over a period of, 5, 6, 7 days, you ask a question or two a day, and you kind of keep an eye and say, okay, well, how's the discussion going? And it's my experience so far is that, people tend to easily elicit from each other quite easily and quite well, and with some surprising results. So one of the questions, and it's funny, I just did a talk earlier today on choosing social media platforms if you want to share your science. And it's a big question. It's very overwhelming to think, okay, well, how do I, what do I pick? I'm not a techie person. And so some of this work I'm going to share with you, I was very fortunate this past year to have 2 undergraduate students working with me. And one of the students, Vanshika Katan, is doing her Bachelor of Health Sciences at McMaster University. And part of her applied research course was to work on a project that I'll discuss in a little bit. And in doing so, she did a great review of the available platforms that are out there for running an asynchronous focus group online. So what we have here is basically a summary of her analysis of 3 popular formats that we've seen in the literature thus far. And what you can see is that they're mainly categorized by either A, your social media platforms like the Facebooks, B, your blogging platforms such as the WordPress, or you can use any blogging platform, or business tools such as Slack, that third column. And so there really isn't one ideal runaway, this is the best platform that we can use. So you're going to have to consider what works for your project, your resources that are available. For example, Facebook's free. And it's a great tool if you're if you're using if you have a study that is unfunded or has minimal funds to, and you want to maybe, divert those elsewhere. So you would look at maybe using Facebook as opposed to a WordPress or a Slack, that some of the features that would really enable your use of and producing focus groups requires a subscription or requires a cost per so many messages or so many users. You also have to consider, is it easy to organize the conversations? Once everybody starts going on discussion boards, it gets really challenging to keep track. Slack's really great for that because you can do different channels, basically different file folders where you can have a question in each one to keep things organized. It gets a little unwieldy when it comes to Facebook and WordPress, the discussion threads. And I mean, all of us, I'm sure, have been on and seen discussion posts in the comment threads. And sometimes things can get really into the weeds and you're thinking, okay, where did this start? So, and that's both for the user and for the one doing the analysis afterwards. Can it tap into existing groups? Facebook obviously comes ready, with lots of existing community groups. It also, and same with WordPress. WordPress has a lot of blogging communities that you can advertise into and invite in. Slack is really restrictive that way, that it's primarily set up for business users, and as such, you bring your own business into it, and then bring, you can't really reach out or explore other networks within that. The one thing that all of them have going for them is that, only the participants in your study can see who's in the group. So nobody else from the outside will be able to look in and see who is in that particular group. So that's a nice feature when it comes to designing the study, ensuring some of the confidentiality as much as one can with a focus group. Of course, anonymity and privacy, those are always going to be challenges when it comes to Facebook. It doesn't mean that you can't use Facebook, but keeping in mind that WordPress and Slack, you can have you can change how you present your name on it, or even use a particular handle. Facebook, it's whatever you signed up for Facebook, and a lot of us probably use Facebook, so it's not necessarily as anonymous in that sense as the other platforms. And is the data private? Well, none of them get a gold star for privacy in the sense that, can I sure it's locked in the Scrooge McDuck vault? No, it's you have to be very mindful, where is the data stored? Is it in Canada? Is it on a Canadian server? You know, who has access to it? How can you download it? Does it live in perpetuity on Mark Zuckerberg's personal computer? All of those things. So you just want to read all the terms and conditions and make sure you have a firm understanding, because regardless of the platform you use, you have to be able to communicate that in the informed consent to your participants. So the take-home messages, there's definitely options. They're all going to require some consideration. And I would argue consultation with those, maybe some target audience members who might be participants or could be participants in your particular study. So how do they work? So what I wanted to share with you is just give you a brief rundown of, you know, what is an asynchronous focus group online, and then what happened over the past year, that I can share some of the insights into that. So I'm going to share a couple insights, case studies about that. Like I mentioned, Vanchika's study. So Vanchika was doing her this project, this applied research project at McMaster. She was with us last summer as a summer student doing research on a Healthy Seniors pilot project funded study called MBPAW, the New Brunswick Brain Health Initiative, preventing Alzheimer's by lessening modifiable risks. And that overall portfolio of studies is run by Dr. Pamela Jarrett, Dr. Chris McGibbon at Horizon and UMB, respectively. And they have a number of different studies looking at, you know, potential pilot studies on how to actually prevent through exercise, through cognitive tasks, to potentially prevent dementia from, or prevent the progression of cognitive impairment, at least in terms of a pilot study design and whether it's acceptable to the people who are the target audience, what have you. A part of that is a patient engagement piece that Dr. Linda Yatman and I were tasked with managing. And what we wanted to do, so we brought Vanchika on board with us along with some colleagues at Vitalite. And as you can note, 6 community research partners. Our original goal, because of the pandemic, because you know, we want to understand in this study is what are the factors that make it easier or harder for somebody to take part in some of these programs that Pam and Chris and the rest of the team are designing. You know, it's all well and good that, you know, I say that exercise 3 times a week with this piece of equipment or doing puzzles on an iPad or what have you, that these are all good in preventing. But if there's a barrier to participating in all that, well, that makes it challenging to then, you know, it's a lot of good work, but, you know, we need to address those things as well in order to then deliver those programs effectively. So that's really what our study was about. So what we wanted to do was engage individuals who either are older New Brunswick adults or are, you know, taking care of individuals who perhaps have cognitive impairment, and say, okay, you know, what's the best way of, you know, getting sort of this needs assessment done, that we're talking about this program evaluation. And of course we think, well, focus group, that'd be a great format to do. For a number of design reasons, we felt that the pros outweighed the cons. And so we've been working with our community research partners since September. We've had 4 meetings, and what we found, you know, after, you know, Vanchika just presented this last week at her end of year health research day. And so there's a table you can see there, and combating the limitations, the pros and cons. But what we ended up finding is, after, you know, researching this information, is that our patient research partners or community research partners actually felt that it would be a challenge to engage individuals, the amount of individuals we wanted to engage that were, you know, 60 and over, across New Brunswick in various, you know, urban, rural capacities, en anglais, français, like everywhere. And because, well, for example, one of our participants, you know, they said, well, I live in a building, there's 80 of us, there's 5 computers, I own 3 of them. Well, if we're gonna look at doing an online focus group. They liked the asynchronous part of it. That was ideal. But the online part actually turned out to be the problematic for this particular study. So this is kind of my plug as well. This, when you have the opportunity to work with and engage and bring to the table your community research partners, do it every single time, because this is the information you get. We would have gone down this happy road because we done, looked at the literature and felt, you know what, in a pandemic, this makes sense. Well, it turns out, it actually might cause us more problems. So what you can see here is after several meetings with our team, lots of great discussion, we've decided to go with an online survey. So you still get the asynchronous part. Individuals can do that any time of day. And the questions are more or less what we probably would have asked in a focus group, but we're addressing there the online, the place. And so there, we don't, with the online survey, we are also offering options for telephone or mail survey to really address, if I don't have a computer at home, or I can't access a library or somebody else's computer or device, I can call this phone number and I can do the survey over the phone in English or French, or I can get a copy mailed to me and I can return it back to them to take part. But I think moving forward, it would absolutely, it was an interesting, approach to, understanding that the asynchronous part in this particular case wasn't necessarily the problem. And I think there's a lot of great information that Venchika's research has highlighted. For myself, it was a learning experience for myself to understand this particular tool. The second piece, and I think a few of you who are in the Department of Psychology would be familiar with, is someone I had as an honors student this past year, Aaron. And Aaron looked at, he wanted to do a qualitative study on the anticipatory grief of adult child caregivers of those living with dementia. So the anticipatory grief is the idea that one experiences grief before the individual has died. Normally, not normally, but I guess we'd often think of grief as something that happens after the fact, after somebody has passed away. Whereas with dementia often being termed as the long goodbye, an individual will actually, you're watching this change in an individual's personality and ability to take part in activities of daily living. And you're really saying goodbye so many times, over and over and over again. And you develop this anticipatory grief that perhaps extends longer. There's a lot of, it's an interesting phenomenon because, we have a formal healthcare system, but as he points out in his thesis, there's a lot of informal healthcare that takes place. And this was looking at the adult child caregivers. So in this particular case, we talked a lot about, do we do interviews or do we, how are we going to go about this? Do we do a survey? Did feel the survey would get the depth we were looking for in this particular study. He really wanted to understand and explore the richness of individuals' experiences at providing care and that experience of grief. But we were concerned as well with the interviews that the interview format wouldn't necessarily, we were concerned with COVID, basically. It was a COVID decision, making sure that this is something that could work, especially with an honors thesis. As many of you know, there's very, very tight timelines. We got approval in mid-January, and he had to have all his data collected by mid-February in order to present last Thursday his honors thesis. So, it's funny, like where we didn't end up using it in the bigger project, I thought, well, this actually would be a good approach for this particular question. So that's what we did. And we recruited on our existing own social media accounts. We recruited via newsletters, and we got 7 participants in total. We would love to have more. So, we have questions about whether saturation really was reached. But it certainly is a pilot study. I think for the purposes of the work, it was informative. And before, we can certainly discuss that in more detail as well. I will say that the unexpected surprise, and again, is it just the 7 that participated because in that selection bias? But they actually, I found there was a lot of sort of support amongst the individuals that were talking. So on the focus group, they actually started sharing resources offline. They started sharing, well, I went through this, I'm at this stage with my mom or my dad. Oh, I'm at this stage. Well, you know what I found really useful was X, and they send each other links, and I think they're even meeting up for coffee. And it was a very nice, unintended surprise. And I wonder, as a sort of a question moving forward, to think, as a method of, people talk about finding sort of purpose and meaning through their own advocacy work, and that was a theme that came out. And I wonder if that is, something that could be explored a bit more. So it worked well, but I think with the time constraints, we couldn't get as many as we had particularly hoped for. So I think just to kind of give you some quick tips to leave you with, the facilitation is key. You have to be able to, be on top of it every day and rephrase, ask for clarification. You're not going to have necessarily the same cues that you would if they were in person or in front of you. Encourage participants to interact and connect with each other. And ours certainly did in our experience. Make sure you take, like I said, good look at that terms of agreement and data storage so you can appropriately communicate that in your informed consent and engage people before you start. So I would say, I'll say that time and time again, regardless of the project. It'll save you so much. But yeah, thank you so much for coming, everyone. I hope that you found that informative. There's my information if you want to get in touch afterwards. Any questions that you might have, I'd love to chat with you.
Thank you so much, Bryn. That was very informative, but I also think it was useful for us if we want to explore this type of methodology in future research projects. For me personally, I definitely would be interested. So if anyone has any questions, feel free to drop it in the chat or use the raise hand function.
Oh, Caitlin.
Hi, Bryn. I was just curious. Now, I know that this isn't necessarily a focus group, but it is an asynchronous intervention that my lab was running. And it was for burnout amongst healthcare professionals. There was oftentimes debate in the lab because we had issues with some of our participants not turning their cameras on, and facilitators finding that, and facilitators finding that the, verbal gestures and expressions being very helpful for understanding whether engagement was, ongoing or not ongoing. What would you say as to what one can do to increase engagement? And do you think that having cameras on during these kinds of workshops or focus groups, do you think it's necessary or it's not necessary, or are there ways around it?
That's a great question. I mean, it's funny as I get it. We all do it too. Like, it is funny, like, and because I think sometimes we worry that we're being distracting to people, or that's why we don't turn them on, or we're in the, lots of things are going on too. We're during these presentations, and I think, so I think that I guess 2 questions. So, is it necessary? Well, I think it depends on what your research question is and the particular approach you're using qualitatively for the methodology. So what, how you're approaching it are the nonverbal cues, facial expressions, gestures, are they important pieces of information that you want to analyze, and how you would build that into your protocol and how you want to code for that and incorporate that into the analysis. I think it's separate from the point where you're asking though, like, how do you get people to turn their cameras on? Because we all say like, oh, hey, love to see your faces. But I think that, I think it does come back to some engagement and maybe some comfort, it depends on, who is it that's responding to your, to your questions. If it's somebody who's, fitting in this particular topic or in between, caregiving, for example, I'm just going to bring that to mind, and I'm running, doing laundry, I'm, doing this, that, and the other thing, but I want to take part in this, but this is the only time, and maybe I don't feel great about, coming on camera, with, so I think it's a conversation with each participant. It's engaging each person.
Right.
Okay, if it's important to your question and to the group dynamics, to say, okay, we really appreciate it, like, and giving them a lot of advance notice so that they know, okay, I have to be Zoom ready versus,
Right,
Zoom, no camera ready, I think is, I think having a conversation and oftentimes the one-on-one will help with addressing some of the fears that they may not want to bring up in a group setting.
Right. Similarly, I guess a related question that I had is we had certain groups, and this wasn't really the case with the physician group or the physician and the nurses group, but it was definitely the case with the research scientist group that we had, that because they were all in a group together as research scientists, they didn't feel psychological safety. They didn't want to share the reasons that they were experiencing burnout at their workplace. And so I'm wondering, in the future, how could we appropriately mix them up so that we're still addressing in a workshop elements that are appropriate to their workplace, but they also feel that safety, the psychological safety necessary to be able to share what's ongoing in the workplace, because some of them were sitting there next to their colleagues in that Zoom and didn't want to discuss what was going on.
Yeah, because maybe, in some fashion it might have related. Yeah, absolutely. I think in that case, again, I sound like I'm beating sort of the same theme over again, but I think really ensuring, like, taking the steps up before you start a conversation with, and laying the groundwork to let them know, hey, and we did this actually in the focus groups with Aaron. We said, okay, we made sure that it was clear that if there was anything they, when we, that they felt very, that was especially traumatic for them, because we're talking about watching somebody they love, lose their faculty, eventually progress towards their final days, and and so it can, past or present, like, it's really challenging. And so we said, look, message us privately and we'll have more of a conversation if you want to call it, like, and I'd like to see more, like, look more into that literature and understand that better. What does that do to the group dynamics? We didn't, or change the group dynamics. We didn't run into that with our particular participants. They were quite candid and vulnerable, and but felt, I guess, we created enough of a safe space. I think when you lay that groundwork and say, like, make sure it's clear to them, hey, you're going to be having a conversation. It's going to be in this format with your coworkers because of these reasons, but I want you to know, if you don't feel comfortable, you can, message me privately. We can reach out if you see as well, like, somebody, and I find this even when I was engaging with our community partners, somebody goes quiet for like the rest of a call. Yeah. Like, not feeling like there's something spidey sense going off there. I'm going to go, and we would follow up with an email. And, I found early on, like, that was especially, important to make sure, to address their concerns that they don't want to bring up.
Yep.
Yeah. And I think it's at the end of the day, it's really about, it's the respect and the relationship building that we're all doing with each other. So how would you reach out to somebody that, looks like they're uncomfortable? Like, how would you want to approach them? Yeah.
Okay. Yeah, that's definitely helpful. Thank you so much.
Oh, good. No, my pleasure.
I have a question for you. Well,
sure.
So I am planning on perhaps using focus groups in the future. So this is very just like technical. So what would you recommend as a minimum and like sample size, but also a maximum sample size? Because you do want to have enough power to detect, but you don't want to overwhelm the conversation. If there's too many people there, it's like harder to direct, imagine. Yeah,
no, that's a great question. I think the key there is planning for enough group. Like, originally we had hoped for groups that had 6 or 7 people in each one, and getting closer to 20, 30, that we thought maybe then we, with a thematic analysis, which is what he used, that we would achieve saturation. And that's the key. It's not so much the power, but really the saturation of, am I are no new themes coming, are we identifying in the data? And so you plan for that and then adjust accordingly. So understanding that it might be less than, if I plan for 30, but you know what? Keeping, looking at the data that we have, we're not getting anything new. Is there, and if there's no other questions that can be at, like if there's nothing else to explore, then you would have to say, okay, well, I think for these questions, I've achieved saturation. I've achieved what for the purposes of this study. It can go the other way too. Maybe after 30, you're thinking, oh, geez, I just there's more things there's more complexity, and that's also great. But then, then you may take a step back and say, okay, is it my questions I'm asking? Is it the research question? Do I need to maybe, take a look and adjust these things? So the short line, it depends too, like thematic analysis is a different kind of animal than, if you're getting into like discourse analysis, where you're analyzing just the minutia of an individual's, the pauses and they, when that person sighed here, well, that's, what's the meaning, that changes, that colors the tone of the words differently than if they didn't. So, but that's a lot more data than, so I think, kind of following up to what Caitlin was asking, are you going to record visuals or not? If it's asynchronous and you're using strictly online, using a Facebook secret groups like we used, or if you're using other format. I mean, the nice thing about that was that the data was there. Like it was copy and pasted into Word. We scrubbed of all the identifiers, and it was already transcribed, which is a nice bonus in that sense. But even still, with 7 people, I think we had 250 pieces of codes that we were going through and assigning to theme. So it became quite it's still a lot. I think you have to plan for a lot. It's going to take more time than you always think. That was a very long ran about answer. Did I answer your question?
No, you did. It's very helpful. Yeah.
Okay.
Thank you, Bryn.
No worries.
Do we have any more questions for Bryn? Yvonne.
Sure.
Hi, sorry, it's a minute here. There we go.
Yeah, no worries.
No lights in my office. Okay, hi.
Hi.
I love this idea so much, and it's relevant to stuff that I'm working on like right now, which is perfect. My question is about how to encourage participation and deal with lack of participation without being coercive or offering unrealistic incentives or the like.
Yeah, no, that's a challenge, I guess, across all of the platforms, all the ways you may want to collect data. I think, in our experience, our case, it was, we went everywhere. We were on particular community groups on Facebook, because we kept primarily a Facebook, recruitment strategy, but also using, I think Twitter was a huge help in that regard. And saying, okay, well, how are we going to, in terms of encouraging data, and so we went pretty expansive with that. We tried to find as many people as we could, and we shared, and but after we hit our sort of time limit and had to kind of say, okay, we have to kind of call it here. But for incentives, I'll be honest, it gets harder when it's community versus university, because you can't offer a bonus point. There's no bonus points for, depending on your, what you're doing. But I think, and so you are going to get some selection bias that way. I think what you're going to see is the people that joined our groups, they just wanted to help. They wanted their experience to have meaning. They didn't want other people to have to go through it. Now, that may not translate into everything, like every area that you're working in. But for ours, they wanted it to mean something. And I can resonate with that. Yeah, so I think knowing that someone was going to do research, ask these questions, and potentially do something with it to hopefully, and we didn't promise that it would change a policy or practice, but I think even just contributing to that meant something to them.
Mhm.
And like one person talked about how they became an advocate after their experience and how that, so I think there's something empowering. And I think, again, if you know the people you're working with, your target audience, that population, and then you can go and, talk to them what makes sense. Like maybe maybe it doesn't, it's not, gift cards or a draw for gift cards is often a frequent one, but maybe it's understanding the type of gift cards or knowing, how thinking of the ways and asking them, how can we make this easier for you to participate?
Mhm.
Yeah, I think it honestly is asking if you can find someone in that group and a few people so that one doesn't speak for all of them to ask and say, okay, well, how can I make this easier? Because I come from it from a certain lens and
Mhm.
accessibility, I may not have that. Yeah.
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 Great suggestions. Thank you.
Oh, no worries. And I guess the other thing I'd say, don't be afraid to pivot either. Like I really wanted to use it for that study, but you know what? It's going to work better because they identified in our case, in particular, challenges with establishing a virtual place. So.
Yeah. Thank you.
Well, yeah. How do
Yeah, I
you
was gonna read there. So we have a question from Crystal. How did you share with research participants what you did with their data? Could you contact them after to do this?
Yeah, so we asked them if they wanted to receive a copy. Or if they, we invited them to reach out to us as well. So they have our information and we'll let them know how it was used. And that's really the best way to, I think with a small group, just understanding how it went. And yeah, again, like I think that can be built into your knowledge translation plan too. So, making it clear on, your informed consent, but also your plan to say, we're going to produce an infographic or we're going to have something you can share on Facebook that is, it's summary level data that shares some of the main themes, that kind of thing. I think that's, but letting them know that they are more than welcome to ask you questions, to reach out to you if they have questions about how the data was used and what the results were. I find that, we often say that, don't we, in debriefing forums and informed consent, but I haven't had anyone necessarily reach out to me, but I wonder if maybe I've not made it easy. Maybe I've made it, and I have to reflect on that as a researcher too, say, okay, well, maybe there's another format. Maybe this seemed, or maybe they were just happy to contribute and move on. Maybe it's all of the above.
To follow up on Crystal's question, so both of your students presented recently. Were the participants invited to come attend the presentations?
They were not, no. And that's a really great point. And I think, I think, moving forward, I would look at that and change that, both for the community research partners. They're not participants, but they're sort of because there really wasn't any other participant with Van Schika's study that we have right now, because we're getting REB approvals for those studies. We let them know that, our meetings are done until probably the fall, but we're going to keep you updated every month with a sort of summary email, and we'll share her poster with that. We'll let them know how it went. They're also, and they have reached out in the middle to say, to ask questions. It's about building that relationship and keeping it open, and if, letting them know how things are going to go. So for that one, but then and if I think they recorded her presentation, I'll probably send it to the participants as well. It was kind of a last minute when I got the info. So it was virtual day, but then with Aaron's presentation, no. And I think, I think it would be good to reach out to them. I think I'll touch base with them once everything kind of the dust settles with that. It's a really great point, Danny. I really appreciate you bringing that up.
Thank you. I think that's it for questions. Caitlin left a few comments for specifically for Yvonne's question.
Oh.
More suggestions on having like participants interact and engage.
If anyone uses this, I'd love to hear, like, I mean, reach out. I'd love to hear how you, if you could take this approach and how it works for you. And if you have questions about like, addressing some of the REB application parts of it, how you address some of the comments from that the reviewers may have had, please do reach out to me. It's bryn.robinson@horizonmb.ca or at Bryn PhD. And we can definitely set up a time to have a chat, discuss some of that.
I will probably do that.
Absolutely. I'm serious. Take me up on that. Yeah.
All right. Well, if we have no other questions, we can end this session here. Thank you so much, Bryn, for speaking today and for sharing us your knowledge and your projects.
My pleasure. Thanks so much for having me, everybody.
All right. Have a good day.